Hi, welcome to the Nursing Dose with your host, Farah. Today we have a very special guest. We have Dr. Nancy Mannion. We're going to be talking about all things nurses and why it's important for nurses to be on boards. So, thank you so much for taking the time to speak with me and to the audience here. Such a pleasure and honor to have you on the show. If you want to say hi and introduce yourself to everyone.
Good afternoon, everybody. My name is Dr. Nancy Mannion, and I am excited to be part of the Nursing Dose. This is our first podcast together with Dr. Farah. So I'm really eager to share some information with all of you who are listening about the impact that nurses can really make on the welfare and well-being and health of our communities.
Yeah, I mean, it's so important these days. There's a lot of talk, I think in general about, nurses being able to make more decisions and to be involved in these bigger organizations and to sit at tables to make these big decisions. So if you want to kind of talk about the history of nurses on boards and kind of how it came about.
A great question and a great way to introduce the Nurses on Boards Coalition, which is the organization that I have the honor of serving as the board chair this year and next year. So a little bit about myself and my background. So my clinical background has been in emergency nursing. I've been practicing in that arena for about 40 years. And it has, always been a part of who I am. And in that work, being in the emergency department, you really are. I often say the emergency nurses are like the canary in the coal mine. Like we know when there's a problem in our community before other people identify it, because we're seeing patients in our emergency rooms who are struggling with an issue. Maybe it's that bad outbreak of a respiratory problem or a GI thing. But we see the trend because we're the front line, that front door for healthcare delivery in the acute care setting. And so it's always been of interest to me what's happening out there in the community that's impacting what's happening inside of the hospital.
Yeah.
In my role as a past president of the Emergency Nurses Association, I was invited to be a member representative to the Nurses on Boards Coalition. Now, this organization, NOBC, is just turned 10 years old this very year. It came out of discussion after the Future of Nursing report, which was released 11 years ago. So it would have been something that came out around 2020, about 2010. And it was funded through the Robert Wood Johnson Foundation, and the American Nurses Association had an integral part in that. And they realized in that report that nursing was absolutely crucial to the future of healthcare in the United States and was crucial to the well-being of people in this country. And so they began to say, maybe if we were united, if we were really focusing on certain types of things together, that we could impact the health of our communities. And so our logo, our slogan is about, that nurses impact the health of communities. That's our mission statement.
Right.
That through board service, particularly by serving on boards in communities, we influence the decisions that are made that can change the way people appreciate and have access to healthcare. So it started off like with a germ of an idea, a couple of nurses really passionate about this, and it spread. And they began saying, who else could be part of this? What other organizations do we want? And so this coalition was built. And as I said, this past June, we had a big celebration where we really kind of lauded what we had done in 10 years' time. Our goal was 10,000 nurses serving on boards by the year 2020. Well, as you know, during 2020, we faced some pretty significant challenges. And so we didn't actually hit our target until January of 2021, but we're claiming the victory that we were able, as a coalition, to place 10,000 nurses on board positions that serve on boards that impact our communities. And what do some of those boards look like? Some of those boards are not like, oh, me, I served on the ENA, Emergency Nursing Association Board of Directors, but we have nurses serving on boards through AARP, through the United Way, through the Pop Warner Football, through companies like Stryker and Laerdal, which are familiar to those of us in healthcare as
Yeah.
people who develop products that are used in healthcare. In the American Heart Association, American Nurses Association, and the American Lung Association, we have placed nurses to serve in these entities that look at the big picture of healthcare. But when you look at organizations, if I have nurses serving on local food banks, Pop Warner Football, the Meals on Wheels that service the elderly, they are impacting healthcare to those populations in their own communities. And I think that is the most meaningful part of the work that the Nurses on Boards Coalition does, because we are really in our communities, in our neighborhoods, knowing the players and saying, how can we make this better? I've often thought that if there was a nurse serving on the water board in Flint, Michigan, which we know, to this day still
Yeah.
struggles with providing clean water to its community, this problem would have been identified much sooner, and a nurse would have ensured that it was fixed, because that's what nurses do. We're problem solvers, we're innovators, and we don't take no for an answer because we're patient advocates. So
Yeah, absolutely. Yeah.
that's the kind of behaviors that and the type of actions that the Nurses on Boards Coalition take.
I mean, that's amazing. I want to, say thank you, and such a big accomplishment for the whole coalition and all the nurses who serve on the boards, uh, because it makes such a difference, and like you said, such an impact when a nurse is involved, because nurses really see healthcare from all aspects, right? And we look at it from a more comprehensive kind of way, especially with, when we talk about the social determinants of health and all these things, not only, from an acute care side, but looking at it from communities and things like that. So that's amazing that, you were able to get that many nurses to serve on boards. And, for those of you watching out there, if you have any specific questions about maybe how to serve on a board, if you are interested, please let us know in there. And if you can share with them how they can get involved,
Sure.
and how can they decide kind of which board would be right for them if they are interested to take action and also be on board with this movement.
Thanks, Farah. So we have very seriously looked at what does a nurse need to feel comfortable serving on a board?
Mhm.
Because like everybody else, there was a place in my life where I was like, serve on a board? What, are you kidding me? Who's got time for that? But if you're committed to something and you're passionate about it, I think we all know we can find the time to make it happen.
Mhm.
But it's a very good question to ask. If you're interested in board service, how do you make the time? What is the time commitment? So NOBC wants nurses to feel ready to serve. And to do that, we've got some resources available. So let me begin by saying you can go to our website, which is www.nursesonboardscoalition.org, or just Google Nurses on Boards Coalition, and it'll take you to the website. On our website, we have a lot of resources. We are in the process of developing, and it will be launched in early 2025 in collaboration with the National League of Nursing, an entire program built with micro-credentials called Language in the Boardroom. Now, you and I, as nurses, we know, and you in the audience, we have a language, right? We say, oh, that LOL and NAD down the hall in bed 12, and we're talking about the little old lady in no acute distress. So we have a lingo. And it's no different to have a lingo in the boardroom. There's language that people talk about when they talk about financials, when they talk about fiduciary responsibilities, when they talk about goals and objectives.
Mhm.
It's not necessarily a language we fully understand, but it's learnable. And so this program is going to teach you if you sign up for it through when that link comes out, so you can follow me on LinkedIn, and you can find out the information because I post all the time about NOBC. But in that is going to be, what's the voice? What's the language? When people talk about something, what do they mean? And it's a series of small micro learnings all together. At the end, you have this micro credential that says you have taken this course. And I think it's going to be a real help to nurses who feel, and I see someone's responded, I live in Florida, I've always been intimidated about board service. Taking a course like this will teach you what the voice of the boardroom sounds like. But in addition, we also have other resources about board preparation. Like, how do I know I'm ready? And there's a self-assessment tool that you can take that, like, what talents and skills do you have? Trust me, nurses are so talented and we cut ourselves short. We know how to do integration between physicians and other entities within the healthcare system. We coordinate, and we know how to advocate. We're the ones on the phone at 2:00 in the morning calling that physician and saying, your patient is sick. What do you want to do about it? And that same voice can echo in a boardroom. Wait a minute. We're not providing a service very effectively. How can we do this better? How do we know that the people we're serving are getting the right kind of nutritional food that they should get? Right? So we can challenge the status quo, and we can amplify the good work that's being done because we know how to do it already intrinsically in our nursing position. But how do we polish that up to sound like we're a boss lady in the boardroom? And that's really the voice that you're looking for. And so to me, it's not just having a seat at the table, which NOBC can help you find, but it's also knowing how to use your voice at the table to advocate for the things that are most important. And so these learnings and these programs that NOBC has developed, because we consider ourselves somewhat expert in being able to provide that learning, it's there for you. And all you need to do is go to nobc.org and find it. So take those learnings. We also will help you with a board placement. We post when there's a board placement opportunity. And I'm happy to see there's someone in Florida. We get a lot of Florida opportunities. The city of Orlando has made an agreement that they will place a nurse on every one of their civic boards. So that's Parks and Recreation, that's their electric board, their water resources, everything that the city of Orlando has as a city board. They've committed to providing a nurse. And they're coming to us to help us find them. So register first thing. Everybody who's listening, go to nobc.org and register on our database. We have 26,000 nurses who have said, I'm interested. We've had almost 11,000 placements. We want to place more. So tell us what you care about. Tell us what your interest is. We'll help you find a board opportunity. Then take our courses. Feel confident that you're ready to serve. If you apply through NOBC, we will help you polish your cover letter. We'll look at your resume with you. Our staff does really great work to support someone who wants to apply, to make sure that your cover letter says what the company that's asking for support and a board placement is looking for, so that we make sure your letter sounds like you and what you can bring to the table. So we are also very eager to find more board opportunities. So if you know somebody in your community, like your mayor, right, or the head of your local United Way, send them our way. Tell them we can help them place nurses on boards in their communities so that we can help you find that seat.
Yeah, this is amazing information because just recently, and I think before we kind of met, I had mentioned to you that I was interested in joining a board, and I get the like automatic email messages, right, and it kind of tells you what the requirements are and things like that. So I'm still looking. So definitely take her advice and go to that website. I'll share more information after the show, where you can find more information. So I appreciate that. And I actually just moved to Florida just recently in the Tampa Bay area. So I'm going to have to look around here as well. And then I guess, what would you say has been, the greatest kind of lessons that you've learned, let's say, serving and meeting these nurses? What are some of the great benefits that you're hearing, and what have you seen, in these past few years?
Great question. I just want to do one little follow-up. I'm looking at the comments in
Yeah.
the chat. So what I would recommend is to, for those of you interested in learning about board opportunities, when you register at the Nurses on Boards Coalition website, they will send you automatically when there are board opportunities.
Yeah.
Some boards do have residency requirements, like we need somebody from New York State, or you have to live in the city of Orlando. So my recommendation is to, if you want to write the info at Nurses on Boards Coalition, our email, and tell them you're interested in a specific geographic area, they will make sure that they can look in the database and see if there's something available in your geographic area to begin with. And then as you get the announcements, we're really looking, as we move into 2025, we just talked about this yesterday, targeting more of our board opportunities to specific areas, that when we know that it's Texas, how do we target nurses in Texas that are in our database? So we're really looking to really tailor that. So a really good ask from the folks in the chat. But back to your question, what have we learned? We did a research study last year. We put a call out asking nurses who serve on boards to respond to a survey. We expected about 400 responses, and we got almost 4,000.
Oh, wow. That's
So
pretty
to say that we have a lot of data to look through is just an understatement. We are starting to dig through that, because the real research question is, what is the value that nurses bring to boards? And we've done some research on what do board members think about having nurses on boards, and overwhelmingly they have said it's a positive. It's a win because of what they bring, the perspective that nurses bring, and the sense of connection to community is very powerful. And so, Farah, I will send you a couple of links to some articles about the value of nurses on boards. But we will be cutting and dicing this data that we got out of 4,000 responses for quite some time. But we have produced some preliminary articles. But no one has said it's a bad idea. Really sorry that you have a nurse on your board. We've gotten testimonials from leaders in the United Way saying the value that these nurses bring, the insights that they share, and how they help hold everybody accountable. And that's very valuable, because that helps us when we go out to an organization and say, surely you really want a nurse on your board. And they say, why? And we say, because here's what your peers are saying to you about why it's good to have a nurse on your board. So it's been received extremely well. We've got a lot of years now. We've got some depth in the bench to be able to go back and ask people what the value is. And our research is demonstrating what we really kind of knew in our hearts to be true, that it is a really beneficial thing.
That's amazing that you got that many responses. And now, like you're saying, you have the data and the proof to show all the benefits, that nurses bring to board. So,
and I want to thank AONL, the Organization of Nurse Leaders, because they provided some research funding for that massive, what turned out to be a much more bigger study than we expected. But we had, professional nurse researchers working on that, as well as we engaged with a university and tapped into their research department, their statisticians, to help us manage the data. So it's not like, just something we've done on the side. This is a professional arm of NOBC. We've actually created a research consortium that will launch in 2025, because we want to continue to understand the value of having a nurse on a board.
That is amazing. I mean, I can't wait. Like, I'm just waiting for the opportunity for me to go on a board. But and I want to thank Dr. Sharoy Hodges. I had her on the show previously. So yes, we're going to connect. I'll give you all the information, and I'll also share in the all the articles and the links that you share with me as well. So I guess My other question, just curious too, like let's say nurses are interested to serve on boards such as the ENA, because as you know, I was a former emergency nurse as well, and I love the Emergency Nurses Association. And the way we got connected actually was through Dr. Shante Harris. So shout out to her.
I
And
know.
she serves on the ENA board now.
She's starting. That's right. She's
Yeah,
actually this very day getting her board orientation to serve on
yeah.
that board. I'm very proud of her. It's been great to watch her ascent in the leadership of ENA, and I think great things in the future for her.
Yeah, she's amazing. So,
Yeah.
what would you say to the nurses out there that maybe are interested in specialty specific professional organizations such as the AACN or ENA? I know you were a former president. So, how can they kind of like make their way if they're interested in serving on those types of boards or potentially kind of getting into these organizations?
I think the pathway is to start local. So get involved with your chapter or your local chapter, or your state council. Most of the nursing organizations that I've been a member of, they all have kind of the local group, they have like a state group.
Mhm.
And when you get in there, you really learn the nuts and bolts of board leadership, right? It's you learn about communicating, you learn about teamwork, you learn some responsibility around financials. Because everybody has member dues, and it's not my money, as I'm responsible for other people's money, and that's a whole different story, right? We treat that very differently than our own checkbook. And so we learn some of those skills at a smaller scale. And then you can turn those learnings, and most of those organizations also have like leadership development programs for them. I know AONL does, I know ENA does. We have a leadership conference annually where state and local leaders come to learn the nuts and bolts and kind of the ropes of being an effective board member. And that then builds up to going to scale to taking it, for example, a national position. So I was an active chapter member. I was very active at my state council level. I became active in a committee at the national level, and then chair of that committee. And from there, I naturally migrated into running for the national board of directors. So there's a little career progression, I think, within nursing organizations. The skills are the same. Board
Yeah.
leadership is board leadership. And whether you're doing it for your local chapter or your national nursing organization or the water board in your community, that language is all the same. So
Yeah.
it doesn't vary. And the skills you learn in a local nursing chapter are going to be very transferable to working in a community organization. So it's all about developing yourself. And it's really about self-motivation. People aren't going to call you up and say, you need to come to this meeting. You're going to have to say, where is the meeting being, when can I join? How do I belong? And make some relationships. I also want to just say, becoming a member of your nursing organization is a very significant part of your professional growth and development. It is part of, to me, I feel like it's a professional duty to
Yeah.
belong.
Yeah.
And, it is a way you network and develop your career path. You meet people in those meetings that you wouldn't meet otherwise. And you start to develop those relationships, and that networking is invaluable. That's how Farah and I met. We
Yeah.
had a common friend,
Yeah.
a mutual relationship, and now here we are, like we're connected,
Yeah.
in doing this. So
Oh my gosh.
it is really important to develop your network, and through that network, you're going to learn about other board opportunities, and it just cascades from there.
Yeah.
So, good question. Thank you for asking that, Farah, because
Yeah.
I think it's very important. Any of the resources that are available in NOBC are applicable to your personal life and your professional life.
Yeah, I'm so happy that you brought that up because I talk about networking all the time and personal branding and building relationships in nursing. And I actually failed to do that as a new nurse in the emergency department because I was so focused on just doing the work, getting
Right.
certified, getting my advanced degrees that I didn't realize, I was part of the ENA, but I wasn't as active as I wanted to be. So this is, and a lot of the new nurses, nursing students and new graduate nurses watch this podcast and the show on LinkedIn. So I really implore them to start networking early and, join things like their own university or college committees, get involved in NSNA, like the National Student Associations. I actually just spoke at the Canadian National Student Association, and I was telling them how important it is to network because like you said, it's invaluable for your career growth and development. You'll get mentors through that, or just one connection can make such an impact in your career. So I wanted to just ask you, I know we're kind of running out of time. What are you excited about for nursing in general? Because I always try to really uplift our profession and make sure that people in the public who don't know much about nursing really see kind of what's up and coming, and to keep it really positive. And what is exciting to you for this next generation of nurses, or just for in nursing in general?
So I'm gonna look in the rearview mirror just a little bit, and say that nursing lived through our current nursing, and some of you who are students have lived through a very historic time in terms of a pandemic. It had been 100 years since the United States had experienced anything quite like what we lived through during COVID. Right. We're really it's behind us, but it was a very challenging experience. I think that we learned a lot about what it meant to take care of ourselves in addition to our patients and others. Because one of the biggest crises that nursing faced was the burnout. We all struggled. We were like, we're going to get through this. We're going to help our patients. By golly, we are committed to, like everything Florence Nightingale said we would be, we're going to be. And then we got tired because we really weren't taking good care of ourselves. And so what I think, is a tremendous emphasis right now on wellness. And how important that is on work-life balance, and how important that is. But I will also balance that by saying that engagement in the profession, not just coming to work and doing your job, but engagement in your profession is a part of self-care, is a part of developing yourself and creating a career path that's going to be unlimited. When I entered into nursing, which was, I think I carried the lantern for Florence because I've been around in it a long time. But I think that, there weren't many options other than acute care nursing. You are unlimited in where and how you can practice. The explosion of telehealth and patients wearing wearable healthcare monitoring devices and nurses hovering over them remotely. That's going to explode in terms of how do we efficiently care for patients. Hospitals at home are going to blow up. I mean, I know there are a couple of health systems in the northeastern part of the U.S., Mass General Brigham in particular, that has done a massively great job of developing a hospital at home. So when I see where nursing is going to go, it isn't just in the acute care hospital bedside setting. You are going to set the mark for delivery of care in ways that were unimaginable, because I didn't have the internet when I was a baby nurse, and you do. So go with it. Technology is going to be a huge driver of where nursing goes. So be kind to yourself, take care of yourself, go for work-life balance, grow yourself. You flourish where you nourish. So nourish yourselves. That's my take. And just be open to wherever the universe is going to take you in terms of nursing. Be the leaders, set the course, always, always, always keep the patient forefront. What's best for the patient is going to be best for all of us.
That is awesome. Thank you so much. And then since you talked about kind of wellness and self-care, I just want to give you kind of a fun question. What is something that you'd love to do to de-stress? And what is one of your bucket list items, would you say?
Oh gosh, I'm a very privileged person in that I get to travel a lot for the work that I do as an international healthcare consultant now. So I've had a lot of bucket list trips that I thought I would never do, but I've got a lot more left, and I haven't quite decided where that's going to be. But I know that traveling around the world is one of my most favorite opportunities.
Yeah.
And so I love to travel. I know some people go, I get in an airplane and go
Oh,
places,
I
but
love
you know what? I love it.
visiting.
I get energized by it.
Yes.
But in terms of like what I like to do at home, I like to cook. And I like to just, I like hiking and being outdoors and just walking around. Spending time with my family is really important to me. And because of my work schedule, sometimes that gets a little blurry. So
Yeah.
those are the way I do that. I think that it's important to engage in the hobbies that you like. So there's always a book near me. You can see in my background.
Yeah.
And that's only one of many bookcases in my house. So that's
Okay.
what I like to do.
All right. Last question. What would you say? And it doesn't have to be nursing related. What is probably one of the best books that maybe changed your mindset or the way you think, or has kind of transformed your life? What would you say? One.
Oh man, favorite books. I have I read a lot of different genres, but a powerful book and don't laugh at me when I tell you this, but it was the Lord of the Rings trilogy by Tolkien. I'm not much of a fantasy person, but to me, it was not fantasy. It was like a mirror of what society can be like.
Mhm.
And, sort of that. I'm a big fan of what's called the hero journey. If you read Joseph Campbell and the Myth, there's a lot about mythology that really is about the human experience. And that Tolkien series, The Lord of the Rings, was really a hero journey for Frodo doing what was the impossible. It's like the everyman doing something to save the world, and that's how I kind of think about people.
Yeah.
That it's a small thing that we may be asked to do, but the impact is so big.
Yeah.
And so, I know people kind of laugh and go like, well, that's not really
No.
but it's literature to me. I don't call it fantasy. I think it's really important literature, and the
Yeah.
story of, how people supported each other and created teamwork. There's so many lessons
Yeah.
to me in leadership around that book. So that's where I'll leave it.
That is amazing. Well, I mean, honestly, I feel like I could speak to you forever about different topics in nursing, but I know you have a busy schedule. But I would love to have you on back next year to
Sure.
talk about any initiatives and, kind of what's going on with the research and things like that. But I really appreciate your time. Thank you so much. Oh my goodness, I think I lost you. Thank you so much, everybody, for watching. Please subscribe to the Nursing Dose. Don't forget to subscribe. And yes, you're back. Thank you so much.
I know. I think there was a little glitch there. We'll be back. I'd love to come back next year. We're going to be doing our strategic plan for NOBC, and we'll have a new focus. And so maybe come back later next year and talk a little more about what's going on there.
Yes, and please connect with Dr. Nancy Mannion, and she will bring all the links. I'll put them all in there for you guys. And again, thank you for being such an inspiration, and thank you for all you do for nurses. And I appreciate your time. Thank you.